Welcome, everyone, to another edition of STRC's Let's Talk Caregiving. I'm your host, Roberto Velasquez, President and CEO of Southern Caregiver Resource Center, and I'm here as always with my co-host, Marta Rañón, our Executive Vice President. How you doing, Marta?
I'm doing great, Roberto.
Fantastic. Today we have a very special guest. Her name is Paige Colburn-Hargis. Paige is the Trauma Injury Prevention Coordinator for the Injury Prevention and Community Outreach Program for the Level 1 Trauma Center at Scripps Memorial Hospital in La Jolla. Wow, what a mouthful. Paige also serves as the chair of the Injury Prevention Committee for the Trauma Center Association of America and co-chairs the San Diego Fall Prevention Task Force. We're so glad that you're here with us, Paige, because we put on this podcast and we talk about caregiver issues, and one of the big problems, in fact, it's such a big problem, it's part of the CDC website, are falls among older adults. And so we're really glad you're here because our family caregivers are often dealing with frail older adults and then complex conditions like Alzheimer's disease and other comorbid types of conditions, heart disease, they're taking medications, all kinds of different things and scenarios happening in the home. So fall prevention is a huge, huge topic.
Roberto, I am so happy that Paige is here, and I'm looking forward to speaking with her a little bit more about her experience with the work that she does. And I keep thinking about a lot of the caregivers that we serve, especially those who are caring for individuals who, as you say, are within that fall risk and how to prevent those. A lot of the falls that happen in the home, for example, can be preventable, and we often are talking to caregivers about modify this, install grab bars here, but it really is something that we have to see from their perspective, right? For us, we might say, okay, yes, you step down, you step up, and you go into the home, but it might not be so easy for someone who has maybe mobility issues or is frail and elderly. And I'm curious to hear from Paige, how you help families navigate that.
That is a really tricky, sometimes it's almost feels like the waters are filled with alligators. It's a difficult thing to navigate. Often, I know in my own life, I am a parent. I have children that are out of college and somewhat launching and kind of coming back and launching, and you know how that process of life. But I also have six beautiful parents in my life that are all over the age of 80 and one over the age of 90. And it's that balancing of, as a child of a parent, is like knowing when you can step in and talk to them and have those courageous conversations. And sometimes, like there's all kinds of things that happen in family dynamics that sometimes that's a very big role reversal from, who's, quote, I'm air quoting, who's in charge of the house, right? Like, so I've definitely been having to navigate those waters myself.
You are making me laugh as you're saying this, because I think a lot of us who are caregivers, who have been caregivers, maybe they're in that situation or about to launch into that stage in their life. It's really challenging to try to figure out the best way to convince someone that maybe they should take precautions, especially when all of their life they've been so independent. And I'm specifically thinking about a family member who was visiting the other day, and she was talking about her father, who is elderly and has fallen recently. And so she did what a lot of us caregivers would do, which is, oh, let me get you a cane, and that way you don't fall again and it helps you. And he said, what for? I don't need a cane. Well, you just fell and we're trying to help you. And there's that reluctance and that resistance from the ones that you are caring for. I don't know if you would agree with that, Roberto. how that's been
Absolutely,
a problem.
absolutely, that's so frustrating. I think from the standpoint of a caregiver trying to convince somebody, because we know that the data and we know from experience that once you've fallen, their likelihood of falling again is going to happen. It increases your chances, and also one fall that may just require cane could lead to hospitalization with a broken hip or a head injury. The head injuries, 1 out of 5, according to the data from the CDC, 1 out of 5 older adults who fall suffer a head injury. About 3 million older adults are treated in the ER after falls, and it's either head injury or broken hip. So yeah, it happens and it happens again once it starts happening. So I mean, it's frustrating from the caregiver standpoint because you know that it's going to happen, and yet you have the care recipient or the person, the frail older adult, who's saying, "Yeah, I'm okay."
I totally agree with you. And I think, though, is that sometimes like we have to be careful when we say we know that it's going to happen because it's, if we take steps, it's not inevitably going to happen, correct? Right? Like,
Mhm.
so it's not a foregone conclusion that, like, oh, you've fallen, you broke your hip, you're a goner. We do know that statistically, you're at a much higher risk. And so these are the cases where it's a big wake up call for everybody. Right. Like, and so I recently went through that with my 90-year-old father. I mean, he's an amazing man. He's lived an amazing life. He has ran marathons. He has put
Mhm.
up with 3 stepchildren, that drove him insane. And he fell, he launched off a porch and he hit his head and he's on blood thinners. And it was like, Dad, you know, Dad, this is a big deal. We have to come up with a solution for you because I know that living in your home with your dachshund and all your books and all your treasures of life, I know that's a priority for you. But right now, this is an unsafe situation for you. And then, I don't know if any of you have this experience of, you're in the business and sometimes people are hesitant. So maybe in your own lives, you've seen family members, even though you know a thing or two about something, they still want to hear it from an expert, right? So,
Oh yeah. That happens a lot. And I was thinking about how often at here at SCRC we do classes for caregivers, and of course our motivation is to help them figure out a better way to prevent these fall risks at home, for example. And we tell caregivers you have to look at it from their perspective, right? I just recently went through a remodel, and you should have seen me trying to tell the contractor, we need more lights, we need more lighting, I want it brighter. And he kept looking at me like, how many more lights do you need? And I said, well, when I turn 85, I'm going to need 3 times the amount of lights that a 15-year-old needs. And he starts laughing because I was thinking about that I in the future, even steps, right? I kept telling him I need steps that are big enough to put my walker, and he's like, what walker? Like, well, in case I need one, I need to be able to put it on the steps where I'm going to be able to balance and not fall to get to my house.
Yeah, that's
exactly.
interesting that you say that those environmental pieces that go along with it with falls. And Paige, I wanted to ask you though, you being such an expert in this arena, what are some kind of likely conditions that could lead to falls among older adults?
Well, quoting our CDC, there's really some key things that put older adults at risk. First of all, being at 65, there's a very large percentage of Americans that are on some sort of prescription medication. They have other comorbidities that are happening, so that puts them at a little higher risk. Some of those medications also have side effects of dizziness, and particularly if you combine them with other medications, there can be an additive effect to that. And then, you add on alcohol or you add on all these layers of things, and then you couple that with a loose rug. You couple that with unsafe lighting. You couple that with a loose step or no handrails or no grab bars. That's when it becomes a very tricky wicket, you know. So there are high priority areas within a home that we want to pay attention to, and particularly, you know, of course, bathrooms. We all know that that's a slippery thing, so it's really important to have a keen eye to make sure that those are safer for you.
Yeah, thank you for sharing that. I know when you add to that mix dementia, like from Alzheimer's or something, now you have, and it could happen without dementia, but you have visual or spatial types of problems. You have an unsteady gait. You might not be able to differentiate between, the hardwood floor and a rug, or
Mhm.
lift your foot to climb a step. So, you add those complications and it makes it even more challenging. And about 80% of all our clientele, our caregivers, are actually dealing with Alzheimer's or a related dementia in their caregiving situation.
Paige, I have a question for you because I know this has been an issue for a lot of caregivers. And I was kind of talking about that earlier, where there really needs to be some forward thinking from the caregiver's perspective about planning, about minimizing risks, about changing maybe the environment. And I know that there is such a hesitation to do that. I mean, I've spoken to so many caregivers that they say, no, 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 my dad's fine. No, it's okay. My mom, she'll just, step over the rug. It's okay. So I'm curious, how do you talk to these family members? How do you convince them that it's really about safety? It's not about, I know initially it's that inconvenience. Oh, I don't want to put a grab bar in the middle of my, I don't know, fill in the blank living room, but it's really about safety.
And I think, you know, for me, it all boils down to good communication. And so if we've waited to have these conversations till we get into these critical kind of phases of our life, it complicates things more. So I would really encourage people to just even though, you know, we're hesitant to talk about these things, but like, hey, what does that look like for you? What are your goals? Where do you want to live your life, and what does that look like to you? And how far would you want to go? Like, it's like, you know, going down and having those conversations. And I'm not saying it's all in one sitting, that's pretty heavy, but I think it's worth having those conversations. And so I know with my parents that I have to be very, I understand that getting older is not for sissies. And it's like it takes something to handle all of these things and still do the things that we love to do. So I really think a lot of it is about becoming informed, empowering yourself with the education. And so that also, you know, with for caregivers, you know, thinking about what is possible, like you brought up, you know, with possible with dementia, with things like this, is like we need to have these conversations because at a certain point, it may not be safe for that person to stay in the home. You know, I mean, we have to have these conversations. And if we don't, we're in a moment of crisis when we're having to make these big decisions.
And thank you for saying that. And I wanted to also mention that I think a big component in this plan or this communication is to include your physician, because first of all, I just know that there's got to be millions more falls and probably not everything's reported, right? I mean, I could fall tomorrow and say, oh, I just scraped my knee. But when you get to be 65 plus, maybe there's something, maybe that should be the rule, right? I mean, I'm not saying it is, but maybe that should be the right rule, to start including your physician in these conversations, or the next time you go to a doctor's visit, because it could be a combination of medications like you were talking about earlier. It could be that you have a vitamin D deficiency or something in your system. It could be all kinds of different things. It could be your vision is now being impacted and you didn't realize how much. So including your doctor, having them help evaluate your meds and if there's anything wrong, and maybe even helping with the doctor and the caregiver being there, the doctor is giving kind of the permission for the caregiver to make these changes in the home,
Mm.
where the older adult is listening to the doctor as well. You know, so I
Yeah.
think that that's really important.
You were basically speaking my love language because it's so true that, involving your physician into these discussions, I think you're probably alluding to some Medicare statistics that less than half of people reported a fall to their primary care physician or healthcare provider. And, that there's multiple reasons for that. And, like you said, they may just brush it off as like, oh, it was minor. It may have been, it may not have been, but it's still something that we need to start thinking about. But people are reluctant because some people have the something in their head that's like a multiple factorial type of thing where they don't want to bother the doctor. The doctor's busy and they don't want to bother them. And then, and then also, maybe they're not bringing these things up because they're afraid people might take things away from them. Kids may be worried about, they may be worried like, oh God, they're going to get on me again and they're going to put me in a home and they're going to take away my driver's license. But we all know those are not, that it doesn't happen that way. It's a much, uh, much more complicated. You don't get to just take
Yeah.
people's rights away.
I remember my father-in-law would say he didn't want to wear or use a cane because people would think he was old. He was 85. So I know there's some resistance, and I know there's a challenge with trying to change that perspective from the caregiver and from the care receiver and from the family members, because things are changing. Things are changing, and sometimes more rapidly than we would want. But again, I keep coming back to the safety. It's a safety issue.
Also when you talk about safety and kind of this inevitable that we're our bodies are changing and we're getting more meds and we're aches and pains and arthritis or joints hurting and things like that. It just kind of leads me to the whole conversation that everybody always talks about when you talk about prevention of these types of things is exercise. How
Mhm.
important exercise, even with just, I'm not talking about weightlifting or running. I'm talking about just sitting at home with a band, and doing leg stretches. All of those types of things strengthen the muscles around the knees, around the elbows, around the shoulders. All of those little things over time really help you with your stability and your flexibility. So, I mean, I say this preaching this, and I rarely do things like that, but
Right.
but I can see the importance of it as I'm getting older, as I've lived, more than half a century now, and I won't say exactly how old, and don't laugh, Martha, because she knows. But it does become fascinating how much I can tell how I am now versus how I was even just 5 or 10 years ago.
I agree. And I think that that is really true. And I am always so impressed. We teach several evidence based fall prevention programs that have been proven to help reduce the risk of falling. And a lot of those exercises are really basic things. It's like a functional fitness. Like, can you safely get up and out of a chair? Can you, if need be, if you were to end up on the floor, would you know how to get up? Like those kind of things, like being able to use our hands, being able to balance, and all of those things, they can be, they can be easily achieved. Like standing at the kitchen counter and practicing, standing on one foot and like they're not major. You don't have to be Arnold Schwarzenegger for these to be effective, right?
You're absolutely right. I'm still trying to figure out from our opening statements page how you managed to have six parents or six older adults that you're looking after. But maybe we'll save that conversation for another time.
Yeah, we might have to have coffee for that
Yeah,
one.
we'll have to have coffee about that. Usually, most of us have two, maybe three. Six is great.
My dad
Okay.
really some amazing women. That's all. I'll leave it at that.
Fantastic. Well, That's all the time we have left for this edition of Let's Talk Caregiving. To hear more of our podcasts, follow us on your favorite podcasting platform or visit our website at scrc.care. I want to thank Martha for co hosting another important discussion, our guest Paige Colburn-Hargis, and our audience for tuning in. If you are providing support to a loved one, you don't have to do this alone. Asking for help is not a sign of weakness, it's a sign of strength. To connect to our programs and services, visit our website at scrc.care or call us at 1 800 827 1008. If you live outside of San Diego and Imperial counties, visit caregivercalifornia.org to connect to the closest caregiver resource center near you. To support our efforts and make a tax-deductible donation, please go to scrc.care and click on the Donate tab. And remember, SCRC is here for you,
Caring for those who care for others.